All right, so in this segment, what we're going to do is basically show you how to use the POLUS Advanced Ultra Unit in a regular practice setting. So the first thing I'll do is I'm going to, as you can see, we already have the POLUS on. I'm going to bring it from its default position so it comes to where it needs to go. Once it's finished moving, then I'm going to lock it in the position all the way down, and it's now locked and ready to go. Now, the nice thing about the POLUS head is that you have two different directions you can go. You can go under. You also have the option of being able to go over, as you can see here. So I will explain both positions. With this position, I have it in, it's already locked and ready to go in either direction. You can go in this direction, for example, or this direction, depending on where you want the unit to be in relation to the chair. So as we move on, I'm going to bring it over to this position. And we have two options. We could either go to the overhead position, as you see here. In the overhead position, it's better if the patient is in more of a lateral position. The other alternative is a under position. The under position we would use if the chair is more of a vertical position. So the POLUS allows you to move the head where it needs to go, and you can always lock into position using this tab right here on the head. Okay, so in this segment, what we're going to do is show you the POLUS Advanced Ultra Unit in a regular dental practice setting. All right, so the first thing I want to do is to bring the POLUS head into a lateral position. And the way I'll do that is basically I'm going to move the arm here, just move it, and it's automatically going to bring it to the position it needs to be. I will wait until it finishes. I'm going to hyperextend, and then it brings it back into a lock position. This allows me to go in this direction or this direction. Okay, so once I have this ready to go, it really depends on where you're going to have the unit in relation to the dental chair. Now, if you have it over there, for example, you might want to go in a different direction. But where we are here, I'm basically just going to bring it around like so to where we want to be. Now you'll notice that I have the head automatically come below. That's our default position because you can hit most of the spots that you need to aim for with this position. Now, when I'm bringing this head around, I'm going to put my hand here on this one segment because that makes it easier for me to move. And I'll have my other hand on the handle. And I basically just bring it over like so. So from this position, I have two different ways that I can actually bring up or bring down the unit. You will see that we have two buttons on the accelerator head itself. You'll also see on the face of the unit where you have the height adjustment. So in this case, because it's easier, I'm going to use the head. And that's going to bring me to where I want to go. And you can see in relation to the mouth, I want to get it fairly close. And it's exactly where I want it to be for now. So we have this as our default position because we want the patient to be able to swallow their saliva as it comes up. Because of course, as soon as the mouth opens, they're going to start producing saliva. So this is the best position for that. However, we still allow for you to bring the head up farther if you so need, like this. But in most cases, you will not need this position. In most cases, the default position will be all that you'll need for your aids. So with this head, if I want to bring it to an overhead position, as so, you will see that I'm going to make adjustments to this piece right here. That can bring it exactly almost a vertical position, but in most cases you will not need that position. And then bring it back to the default position here. So now I'm just going to bring the unit back into its default setting. So again, I'm going to have my one hand here and just fit it over to a natural fit. I'm going to hyperextend and bring it back. And then I'm just going to turn the head like so. I would like for this part here to be facing out because that will make it easier for me to make the turn here to bring it to the final position, as you can see. And then you want to bring it back down. And now it's ready for storage if you so like. So this is the apparatus we use for spot whitening function. All right, so we're going to now attach it to the POLUS head. So you can see we have a tab here as well as here, and that's going to fit into two notches we have on either side of the head I'm just going to fit on one side of the head and then on the other, like so. Okay, so for the curing light now, we're just going to utilize the spot whitening function, and I'm going to bring it over to the head. And you see it just slides down to a natural fit where I wanted to go. And with this, I'll be able to focus on one particular tooth, as you see. With whitening range, we go from full. As I hit it again, it goes to spot. I hit start, and it goes directly to tooth. So we have quite a few advantages with the POLUS Advanced Ultra Unit. We have what we call the light bridge. This is essentially our halogen bulb here. We have fiber optic that brings the full power to halogen to the front. We have LED, and then we also have ultrasound. Now the reason for all three of those elements is it allows us to bring the sessions very, very short, and at the same time to bring full acceleration of the gel on the teeth. So what that basically means is that the sessions are very, very short and you get very, very good results with them. Now, in addition to this, as you can see for our touch user interface here, you have lots of different options you can choose from as a dentist towards different treatment plans you may want to suggest to them. We have voice activated instructions as well for your dental hygienists. We even have air ionizer at the bottom here that actively cleans the air around the unit as it's being used. We also have our curing light that can also be used for spot whitening function. This is very good for devitalized teeth or for after endo treatment. We have a remote control. This can be used both to kind of introduce the teeth whitening session to the patient, as well as to control the session itself. Say, for example, the patient needs to leave or to let people know that they need attention, you have an alarm function. So all these are ways that we've created to be able to make things easier for the dentist to treat the patient.